If you had hip replacement surgery 6 to 12 weeks ago, then this video is for you. Many people stall their recovery because they actually stop doing exercises way too soon. This is a huge mistake because 1 month after surgery is a crucial time to build hip muscle strength and also to work on normalizing movement patterns for pain-free longevity. I'm Matt Sigwa, a physical therapist, and I've successfully treated over 100 patients who've undergone hip replacement surgery. In this video, I'll teach you essential weekly exercises often used at 6 to 12 weeks of rehab. I'll also share some tips for optimizing recovery at the end of the video, so stay tuned for those. Let's get started. At this point, your ability to turn on your butt muscles should be better as you've been practicing those glute squeezes or those glute sets. Now, the exercise that we're working on is a bridge. So here, we're gonna lie on your back on the bed, and all you're gonna do is squeeze those butt muscles, lifting up your hips off of the bed, and you're only gonna go to the point where your hips are level, so your body and your thighs are in a straight line. You don't want to overextend, so as long as your body and your thighs are in a straight line, that's as high as you need to go. Next is a sideline leg raise. So what you're going to do is you're going to lie on your non-surgical side. So in this video, I'm moving my left leg up and down. So this is assuming my left leg is the surgical side. So in this position, while you're on your side, keep your surgical leg fully straight so that leg is locked out. And then you're only going to lift it about 30 degrees and then focus on good control. So smooth movement going up, smooth movement going down. Next is a prone hip extension. With this exercise, you do want to get cleared by your surgeon or physical therapist to make sure that you're within your hip precautions and it's safe to do so. With this exercise, all you have to do while you're lying on your stomach, you're going to squeeze that same side glute. Your goal is just to try to get the knee off the ground about 1 inch. If you can do 1 inch off the ground, that's as high as you need to go. So your goal is really just to make sure that you're squeezing the glute muscle, lifting up the leg just a small height. Next is another variation of a sideline leg lift, but this is focusing a little bit more on your inner thigh. So with this exercise, you want to be lying on that surgical side, assuming that now your tolerance to lying on your side is more comfortable. And all you're going to do is keep your legs straight, and then you're going to do a small lift. You don't have to lift as high as I am, but just trying to get that thigh maybe 1 inch or 2 off the ground. Once you've mastered and feel comfortable with mini squats, you can now start working on these side steps or these crab walks. So you're gonna first just get into that mini squat position. So like a 30-degree bend in your knees, and you're just gonna take side steps going left and going to the right. And your goal is to prevent your knees from collapsing or going together and doing smooth controlled steps. So you don't want to rush through this. So everything is controlled with this exercise. Next is a modified single leg balance exercise. So with this, we want to start progressing you to where you can balance on one leg. The goal is we want to get this to 20 seconds, but instead of just going straight from standing on both feet to standing on just one leg, in this exercise, what you're going to do is you're going to stand on your surgical leg with the foot flat, and then your opposite foot is going to be on the toe. So it's only giving you a little bit of stability. So most of the balance is coming from your standing leg on your surgical side. After you master the modified single leg balance, the next exercise that we're going to switch to is going straight into the true single leg balance. So now your opposite leg is going to be completely off the ground, hands are going to be off the wall, so you're just working on the pure single leg balance. Now the one thing you want to keep in mind here is making sure that as you stand on the one leg, you don't let your opposite hip drop, so you keep your hips level the whole time that you perform this exercise. So at this point, you should have mastered the mini squat as well as the sit to stand transfer. So our goal in terms of progressing this movement is we want to work on getting a deeper or lower squat depth and increase the bend in your hip and knee. So specifically looking at my knee joint, our goal is to get about a 70-degree knee bend. So as you go down, the thigh is not going to get to the point where it's parallel with the floor. So we're still avoiding a perfectly 90-degree bend in the knees. We're just right above that. Now, as you perform the actual movement, the main thing you want to look out for is where your knee travels in relation to your feet. You don't want the knees to collapse inward. You don't want your knees to touch together. So keep your knee in line with your second toe, so it kind of stays in the middle of your foot. And as you travel down in your squat, You don't want the knees going too far past your toes. If they travel just a little bit in front of the toes, that's okay, but you don't want it to be excessive. So it shouldn't be like 3 inches in front of your toe. So at 6 weeks, you should have achieved at this point specific physical milestones in your recovery. You should be able to walk in your home without a walker or a cane, and you should be able to do this without limping or having pain when you walk. So if you're finding yourself still needing to rely on a walker or a cane in your home, then these exercises in this video may be a little too challenging. In that case, I'll link in the description or comments my previous video for exercises that you should be working on for that first month after rehab. Additionally, at the 6 weeks post-op mark, you should be able to individually isolate and activate different muscle groups of your lower body. So at this point, you should have mastered the glute sets, the hamstring sets, and also quad sets, and those should be very easy to perform. Now, if you're still struggling to activate and isolate with those muscle groups and you find yourself compensating, then you want to spend an additional week or two still focusing on the individualizing of those muscle groups before you move on to more challenging exercises that incorporates co-contraction or all the muscles working together. So the exercises in this video may be a little bit too challenging if you still cannot isolate and activate individual muscle groups. Another tip that's going to play a major factor in your recovery is actually seeing how your body responds after you do the exercises. So what this means is if you complete an exercise and you find that you're having more pain and more swelling, that was way too much too soon. Your body's telling you that you either put too much stretch and load on that tissue or on the hip joint and it wasn't ready for it. And if you continue to do that, now you're going to prolong the recovery. You may actually inhibit the muscles from turning on, how we talked about in previous videos, where you have muscle inhibition from having too much swelling or pain. So what you want to do with these exercises is first do a few repetitions or a couple sets, see how your body is feeling during and if you have any pain after. Now, once you have a good sense of, okay, this exercise didn't give me any pain, I can move on to the next one. But if you notice you have increased pain during the exercise, then go ahead and cut that exercise short. Don't just finish out the whole set. Really listen to your body, because you can do more harm than good if you're just pushing through pain and you find that you have more swelling after the exercise. So you know you have that green light, or you're good to continue going if you have no pain or no swelling after the exercise. All right, guys, if you found that video helpful, please subscribe to the channel and I'll see you in the next video.